New Year. Let me call this meeting to order. Want to welcome you to your POA Board semi-monthly meeting, and I also hope that you had a great holiday and came through it safely. Your board does continue to operate under its COVID protocols and will do so for the foreseeable future so as to protect meeting participants. You'll notice that board participants are distanced from each other and that attendance is limited. Today, one board member is attending remotely. Even in this era of restricted attendance at meetings, transparency is extremely important to the board, as is community feedback. To facilitate these objectives, our meeting today is being live streamed, and there is an opportunity for you to comment and ask questions as we go along. We're also recording the meeting, and it'll be posted on the POA website. A couple of other things I want to inform you about, and Kevin Ellsworth and Parker Owen are not here, but this morning they gave the board some really good news. As you'll recall, we applied for and got a PPP loan last spring as we entered into the COVID era. And that was a loan of $1,184,200. That loan was forgiven last week. So that loan is no longer a loan on our books and becomes a grant and will be reflected in the December financials. In today's COVID operations update, we're going to be discussing what we know about the vaccination process, and Winston's going to go into quite a bit of detail on that. But I will tell you, we don't know everything, and it almost changes on a daily basis. So, you got to bear with us. We'll try to keep you informed. The fire department is also here, and they're going to talk a little bit about that, about COVID and the vaccination process. So with that, let's get started. I need a motion to approve the December 16th, 2020 board meeting minutes as presented. So moved. Second. Any changes? All in favor? 7-0. As you'll recall, we also had a special session in which the board elected its officers at the last meeting on December 16th. So in addition, I need a motion to approve the minutes of the board's special meeting on December 16th, 2020. Motion? Second. Changes? All in favor? 7-0. Okay. I actually do believe we're going to get through this meeting agenda fairly quickly today. So we're going to move right on to what I think is probably one of the most meaty pieces of it. And Winston, I'm going to ask you to talk about COVID operations and in particular the status of the vaccination programs.
Thank you, Mr. President. Yes, I'm going to give a COVID operations report, but the first part of this report is going to be about vaccinations. We're working with Dr. Martin, a property owner in Tellico Village who has experience in mass immunizations. He is in contact with the local and regional health departments in the state of Tennessee and is planting the seed that an on-site immunization program for Tellico Village would be the way to handle our large senior population. It's too early for that decision to be made right now. There's a lot of moving parts and pieces going on with this process, but I appreciate his efforts in trying to get this more convenient method brought to the village instead of us dealing with more of a governmental process. We're also in contact with Ms. Teresa Harrell, the Department of Health Directors for Loudoun and Monroe County, and she will be keeping me updated on vaccine information. We were talking last night as late as 6 and 7 o'clock on various questions I had in preparation for this information. And she will keep me posted on new developments, and then I will turn around and have Beth put that on our communication sites for the property owners to be able to get the latest and greatest information. I know that people are frustrated, and I know there's a lot of questions. I just implore them to be patient as we work through this, and I know that this is very hard on our health department. On a positive note about the vaccination situation, Tennessee is one of only 4 states to have immunizations early. So we are at the head of the line in this process, and that's very fortunate for us here in Tellico Village. With that said, here's what we do know about the administration of the COVID vaccine. Loudoun County, as of right now, Loudoun County has enough doses and already has appointments scheduled for today only. They do not have any for Thursday and Friday. They expect to have more doses or a new shipment next Monday. Monroe County is currently out of doses also and expects to get a shipment Monday. Ms. Harold asked that I made this abundantly clear that appointments are needed to get a vaccine shot. They are not administered on a first-come, first-served basis, as we heard about in the news that was being done by the Knoxville Health Department. So please, make sure that you have called or contacted them in some fashion and have made an appointment for your shot. Also, we were informed in the past days that there was a website called Everbright used to make appointments. It is no longer being used. We don't know exactly the reasoning for that, but it is not being used. Ms. Harold has advised me that the state will be rolling out a new web-based booking system Monday, and this should simplify and improve the vaccine appointment process greatly. So, stay tuned. As soon as Ms. Harold makes me aware of the website details and address, I will have it published on POA information sites. Ms. Harold wanted me to communicate to all property owners, Tellico villagers, to assure them that they will get vaccinated just as quickly as possible. And please exercise patience with her department and through this process. The health department staff is working very hard to provide a vaccine to all those that want one, but there's a lot of barriers and a lot of controls and so forth handed down from the CDC and the state that they must conform to. Right now, the shots are going to selected people and of ages 75 and older. We have also contacted Mr. Ed Curtis, CEO of Summit Medical, and he advised me that they are waiting on their shipment of vaccine, and once received, he will get back to me so we can inform our property owners of that as a possible avenue for vaccines. Questions was raised about the second doses and making sure that that was available, because we had heard, as all had heard, that it was a two-shot process. This question was raised, and I asked Ms. Harold about that this morning, and she advised me that the county health departments will be calling citizens and will have a date and time scheduled for their second shots. So if you have your first shot, they will be reaching out to you to have you come in and take their second shots. And for what it's worth, last night on the way home, I heard on the radio that the production of the COVID vaccine is they're holding 50% plus back to make sure that they have these second waves available for the second shot. And they're debating whether or not one shot could do for younger people and so forth and so on. But that is the latest information we have as of this morning.
Yes, please. Minor correction, that is Eventbrite.
Eventbrite?
Yeah.
What did I say?
Yeah, but they're not using it anymore.
No, Everbright.
Okay, thank you. I had the wrong.
No, it's Event.
Yeah, it's no
Okay.
problem.
All right, in my normal Tellico Village COVID-19 operations report, I would like to report to the board and property owners that the ultraviolet units have been installed since Tuesday, 12/29 of last year, at the Wellness Center, and air samples were pulled before the units were put in place, and they will be taking another test approximately 30 days after the installation. And once we have the results on that, we will share that with them. Jeff and Clayton are carrying the ball on the sampling there. The rec department wanted me to mention that they have continued to add additional programs to their menu selection for property owners in the vein of social distancing and spacing and safety. There is a mountain bike class at the Wellness Center. They use grass trails. That's every Wednesday at 9 o'clock. Biking on the cart paths at the golf courses Thursday at 9, starting with Tokwa this week, and it'll be limited to 25 bikes. Hike the Village is now each Friday, 9, offering a 3-mile guided hike starting at the Wellness Center. They have offered some more Zoom classes for online participation and exercise, similar to what you might see on YouTube or something like that. They are offering small group total body conditioning classes at Chota, utilizing the new TRX health equipment system. And they have widened several miles of trails on the Wellness Center trail system to provide better social distancing. Trails have been very popular during this period of time because of the fact that people can get out. And as far as any additional, the rest of the operation is pretty much as it has been reported in the past 2 months. Any questions regarding that report?
Winston, would you address, a subject that's come up recently on Nextdoor about scheduling in the Wellness Center?
Yes, during the COVID period, scheduling for the purposes of separation, traffic patterns and so forth, scheduling has been implemented in just about every aspect of the operation. They are, in the post-COVID world, when that gets here, they will relook at all the scheduling, and they will probably continue to schedule in things like booking rooms, obviously, in the areas of operation that are a schedule is necessary. That will be retained. In all other operations, the rec department and the rec committee, which is made up of property owners that serve on that committee, will be studying the system, studying the scheduling that's used, using surveys, feedback of various forms to decide if it should be continued, modified, or just go back to the way of old.
Okay. I really wanted to address something that's been out there with a lot of misinformation, and I actually need to tell people that COVID's not over. It may be a new year, but we're still operating under the same government restrictions. And those restrictions have to do with distancing, and they have to do with the amount of people we can put in an enclosed space. So that's the reason that the scheduling program will not change for the present time, because we're required to do it by government regulation. So with that, Winston, do you have anything else?
That's all my report, unless there's any
Okay,
questions.
Pat?
Actually, I was looking at some of the figures from when this all started, and I was thinking this morning we've been through an entire government shutdown. Remember when all of the businesses were closed and everybody was forced out of work? And if I look back at the numbers, hindsight being 2020, I don't really think that we were impacted that much February, March, and April, and perhaps even May. But as COVID appears to have been spreading from the metro areas to the lesser population and now to the rural areas, we're actually setting all-time records for COVID cases now. So it is more impactful than ever, I do believe. And as we were discussing today at lunch, some of us had lunch downstairs and some of us are separated. Like Steve is staying at home, and a couple of us decided to eat lunch away from everybody, and that's just everybody's personal decisions. And our choice as a POA board, no matter what I think or you think, is that we have a personal choice to stay away from people or join in crowds. But as a POA board, we do not have a choice. Well, maybe we do, if you'll correct me. I don't think we have a choice to not follow the governor's guidelines or follow the governor's guidelines.
The choice is we have to follow them.
Yeah, and that's what I thought, because the
You're absolutely right.
repercussions of that are, and again, watching the news this morning, what were there, 11 or 13 restaurants and bars closed in Knoxville because they weren't following the guidelines? So we're exposing ourselves to being forced to close.
So again, we're not through COVID. Hopefully, with the vaccination programs ramping up, we'll get back to more of a normal, but normal is a ways off. Other questions, comments for Winston? Okay. One of the responsibilities of the board each year is to approve the appointment of new members to the advisory committees. And before I go through and tell you, who is going to be on the advisory committees as new members or as re-ups, the board wants to thank these individuals for stepping forward and volunteering. And we really look forward to their contributions in the next few years. Each one of these persons has signed up for 3 years on the advisory committee that they're going to be on. And we are truly grateful for their volunteerism. So with that, I'm going to run through it very quickly. The ACC had no changes. Communications has added Linda Garza. Finance has added John Orr and Brad Spiegel re-upped for another 3-year term. Golf added Ricky Moore and Ann Parkhill, and Ron Coles re-upped for an additional 3-year term. Long Range Planning added Jackie Shanudet and Susan Lehman, and Ed Grolemund, after a year of absence from the committee, is returning to the committee, and all 3 of those are for 3-year terms. The Marinas Committee is adding Lee Dantzler and Jeff Ginnow, and Terry Murphy is re-upping and those are all 3 years. Recreation has 2 people that are re-upping for 3 more years, and those are Paul Leby and Rick Thompson. Government Affairs has 2 people that are re-upping, and they serve partial terms. They replace people that had left. So they are re-upping for a full 3-year term each, and that's Carrie Brown and Sharon Jones. And PSAC is adding John Tierney, and Jim Hawkey is re-upping, and those are both 3-year terms. And again, we thank these people profusely for their service to the community. So, with that, and unless anybody has questions, Jerry, the floor is yours. We have today as a guest Chief Jerry Doherty of the Tellico Village Volunteer Fire Department, and he's going to give us an update on a lot of things.
Thank you for the opportunity. If we can go to the second slide. These are the items I want to just address. Is our run data, our membership, an update on COVID-19, and I'm glad I don't have any conflicting information that Winston presented. I might have some more additional information. Just an update on our TEMSCON and then what the major happenings were in 2020 for the department. Next. So you'll see that we had an 8.25% increase in the number of calls in 2020 over 2019. And the split has also changed from EMS has dropped down and our fire calls have increased, or the other calls, what is called others. And the others are basically motor vehicle accidents, fire calls, smoke detectors, CO2 alarms, and automatic mutual aid. And we have responded to 28 automatic mutual aid calls in the year 2020 to Greenback, Philadelphia, Loudoun County Fire and Rescue. They're the 3 companies that we supply manpower to. And that has provided a wealth of training and opportunities for our firefighters that are in the village. So if we do have a fire call in the village, and we had one in September that was a lithium-ion battery that was being charged, and that came in as an automatic mutual aid, and the first I was the second one on the scene, and you could see the smoke starting to come out the garage doors.
Nice.
And it was happy to know that Loudoun County Fire and Rescue and Greenback were on the way to support us. So, of the 73 calls in December, 13 of them were COVID positive calls. And working with Priority Ambulance, we made a decision in early December that we were not going to respond to COVID calls at the neighborhood because they had one whole wing filled with COVID people. So with priorities agreement, because that's who we work for, they said that was fine. So we provide people outside the building. If they needed help, we would go in that way. But it was only for COVID positive calls at the neighborhood. Next slide. This is our roster as of the first of the year. In October, when I last reported, we were at 27 members, and we had 2 retire, and we're up to 31 members right now. So we have an EMR class, emergency medical responders class, going on right now, and in the latter part of January, it'll be the 1st of February, we will have a rookie fire school conducted for those identified as rookies. 3 of the members that we got on board were seasoned professional firefighters that came on board.
Wow.
Next. And this is an update of, yes, sir.
Chief, you might want to go back to the previous slide and explain to them the changes we made in our roles and responsibilities.
If I could do that at the end,
okay,
that's part of my.
because that's big in our recruiting.
It is. So the next slide on the COVID numbers, and that's the ones that I've been sharing since COVID started. And you can see Loudoun County for the year was 4,200 cases with 37 fatalities, and Monroe County at 3,800 with 56 fatalities. Just through the 5th, because they only reported 3 o'clock in the afternoon. For January, there's 198 cases in Loudoun County. 5 additional fatalities in Loudoun County since the first of the year. Monroe County is 175 cases with 1 fatality.
Yeah, this kind of goes to where you were going, Pat. Is if you look at those November and December numbers, it clearly is getting a lot worse.
Yep, and my 2 more slides back, I'll really put the fear of God into everyone here.
Okay.
The next slide. This is the vaccine distribution plan for the state of Tennessee. And right now, we're in the 1A1 on the extreme left-hand side, and that was for inpatient and other high exposures at healthcare workers, residents and staffs of long-term care facilities, 18-year-olds unable to live independently, and first responders. So I can say that 32 members of the fire department were identified, 32 members of the department were submitted to the state. 3 of those members declined to participate in the vaccine. 2 of them were for health reasons. And to date, everyone except 1 person has received the first dose of the Moderna vaccine. So you can see the 1A2, which is where we are.
Let me ask a question before
Yes.
you leave 1A1. It's residents and staff at long-term care facilities. We've had conversation with Angela Smith down at the neighborhood, and they have not gotten vaccines and are not even scheduled for a while. Can you shed any light on that?
I do not know.
Okay.
Because you can see right above the 1A2 is when the 75-year-old plus started. So we're in that zone right now. And definitely the confusion there was you can just show up and get the vaccine. You don't need an appointment, but an appointment is required. The phone system Monday and Tuesday at the health department was down. So a lot of people got frustrated with that because they could not call and make an appointment. But they're up and running right now. The little yellow box I had there for total vaccinations, that was as of the 29th. I can give you some numbers for the state as of the 4th, because that was the last date that was updated. There's been 169,000 vaccinations reported, 12,000 within the last 14 days, within the last day, 12,000, and 91,735 in the last 7 days. So supply is up and down. I mean, as Winston was reporting that Loudoun County is out, and when Loudoun County comes under East Tennessee Regional, so That's where all the vaccines come into that, and then they're distributed to the different counties that fall under East Tennessee Regional. Any other questions on that slide?
Yeah, I have one question as well. According to this slide, school and, childcare staff were in that group that's February or March, but based on what Buddy put out about a week ago, he's moving them to 1A2, which basically he's telling the world that he's going to vaccinate them next week. I thought he had to follow the state rules. And these are the state rules.
This is from the state website, so
Yeah.
it's my understanding.
So,
He may request it,
so is Loudoun County violating the rules openly?
don't know.
Yeah.
Well, I can tell you that everybody knows there was mass confusion on Saturday because people from all of those categories
I know
started
that.
showing up, and not just.
Yeah, I'm well aware of that.
The next slide.
It was ugly.
Okay, this is the one that is fearful. The black dots are basically where we were through, they're the actual reporting through December. And then the colored lines and dots are what the CDC and Johns Hopkins University are forecasting for the month of January and February. So we could, a couple of those sources projected it could be twice as bad as it was in the month of December. And we have not seen the spike from Christmas hit the books yet. That should be starting to roll in within the next day or two, that you'll see the increase in the state numbers and Loudoun County numbers as far as number of cases and fatalities. So
What does the notation ensemble in the second graph mean?
I don't know. It's, all I was looking at
Okay, well, I'm just curious.
Yeah.
It's not that important.
just depending on which, I think the ensemble is basically grouping all of the different databases and saying, okay, this is what it could be. So one of them is saying it's not going to be as bad, but the individual
Okay.
organizations are saying it could be bad.
So it's kind of like an average.
Right. Okay,
Got it.
next slide. This is just saying where we are. We're still at, operating at TEMSCON 1, and that is one vehicle and 2 responders responding to all calls in Tellico Village on medical calls. And so far, next slide. Prior to COVID, we were averaging 4.3 minutes a call. Since COVID, in the month of December, our average response time was at 5.9 minutes. And the traffic light has not really caused any major problems for us. Once they reduced it to 3 minutes, that was a major savings right there. And they do it. And a lot of the people, when they see a light and siren coming, they'll pull over and then they'll flash their headlights saying, come on, from the other side. So we have had 11 calls, what we call on top of each other, during TEMSCON 1. And the second vehicle, somebody would go to the station, pick up the second vehicle and respond to the call. And our plan is to maintain one vehicle in service until there is a major shift in COVID. Yes, sir.
Might want to explain that when we have calls on top of calls, we still have people at the scene. It's just that the vehicle that we send there has some supplies that maybe we don't all carry, but as far as our EMDs and our EMRs, they're fully outfitted personally, and they go to the scene. It's just if they need like a backboard or something like that.
Good point.
We don't have those, it's in the vehicle. But for all practical purposes, each EMR or each person in the fire department carries with them the basic material needed to respond to emergencies.
Emergency calls. And we have I'm going to say 9 AEDs throughout the village, outside of the vehicles. So individual persons have them in their own cars. Okay, next slide. This is just a highlight of our major happenings for the year. Our ISO audit was in March, and we received a 4X for the next 5 years. The Knox-Box program was implemented, thanks to the POA for taking the lead on that for us. Then the churches and then the neighborhood and premier residents are on board, and we've reached out to the banks, and we've had one person come up yesterday as a resident saying, I had a Knox-Box in Florida, can I get a Knox-Box here? And we said, sure. So that's going to be on our website, that we're going to be advertising if the residents would like to get Knox-Boxes. That can happen, and the cost is about $150 per box, and the keys are secured. We've had numerous joint training sessions, search and rescue and confined space, conducted with both the paid departments of Lenoir City and Loudoun City, along with the volunteer departments in Loudoun County Fire and Rescue, Philadelphia, and Greenbank. We replaced our Utility 126 with a Rescue 126. And in December, we were the recipients of the Lucas 3, which is an automatic chest compression device, and we called it Thumper. It has been received and placed into service. The department will be buying a second one, so both of the rescue vehicles will have one once we get out of COVID. So both vehicles will have Thumper in the back seat. Strategic planning, the department reorganization process started, and I'll give it a little bit more of an update on that. And despite COVID, our fundraising has not been impacted.
So what was your goal this year?
I did not see the numbers yet on the budget because Dottie was just doing those numbers for me for our next meeting, so I'll have those and I can report that back to you.
Okay.
But we were above last year's numbers.
Wow, that's great.
And then, knock on wood, no one in the department has tested positive for COVID-19. Next slide. This is just a photo of Thumper. It slips under the chest of the person, and within a minute it can be set up and push a button, and it's automatically doing uniform compressions, and then we can be taking care of the patient, but it's automatic uniform compressions from start to finish till they turn it off at the hospital. As the person's going down the steps or being transferred on a cot in the back of the ambulance, there's no need for another person to do CPR in the back of the ambulance. The Lucas 3 will be doing that for us. They're about $16,000. And that was donated by Priority, and then we'll be buying our second one in the year 2021. Next. Our strategic plan, and that's basically department reorganization. They're the 5 steps that we were working on, and the policies and procedures are completed, and that took a while because following the having to vote on it and get it out to all the members and all, that was a 3-month process. The job descriptions for the different groups are being finalized. The expectations that goes along with the job descriptions are being finalized. The implementation plan is in progress, and we hope to have our final document by the end of the first quarter. Next. And this is how the department would look a year ago. We were considered a fire EMS with the majority of our calls, because we were 75, 80% of EMS. We had very few people that were really trained on the fire side. And with that, we went out with the reorganization. We are now advertising anybody that would like to do fire only or medical only can join the department. And we've had 6 people that had fire experience that joined and says they saw it and they said, this is a very good model, and I would like to sign up and be a dual member, specializing fire, but also supporting on the EMS side. So the next slide, I think, is how our department would look today. So we have a fire division, which would be led by our deputy chief of fire, and our EMS division, deputy chief. And then we have interior structural firefighters, and then fire ground technicians. And on the EMS side, we have AEMTs, BEMTs, and EMRs. And Winston made a comment about possibly giving the vaccine within the local community. That doctor reached out to us and asked if any of our AEMTs would be interested in doing that. So we've had 5 of our department people express that they would like to participate with that. So originally it was talked to be, it could be at the community church, but we have not heard anything more about that. Next. And just similarly what I said before, that the 3-minute max was the great improvement, and it has improved our traffic flow, and we have not had any major problems with that. If we do have problems, the TDOT has agreed that they would put the Yelp activator in, but we don't see that happening because the bridge construction-wise is doing fairly well. They have half of both bridges completed, and they were starting to take up the coating on the second side just yesterday. We're starting to take that up. So that's it. Any questions?
Pat?
I fell into the Bruce trap here. I didn't turn my. There's a gentleman on here named Michael Vaughn, and he's got a very good point here. He says that the data doesn't lie, which you showed up there, how it's increasing, which we also talked about, and should be concerning to all of us, which it is. And he said this is about life and death, and then this is what I want to help you. You're okay. You're okay. I hear this all the time. Yeah, Jerry's pocket's going off, everybody. There
Sorry.
we go. Okay, so to the board, to Rick, to Winston, to Jerry, Michael says, I feel we, the POA, need to step up our intensity of involvement. And I've made a couple of notes here. We're still limiting the access. We're limiting the time. We've hired extra people to go in and clean up touching surfaces or human contact surfaces.
You put in the UV.
Yeah, we put the UV into the wellness center.
And by the way, if it works how we think, it'll go into every building.
Yeah,
we add.
So again, we did the pre and the post test, and if it comes out right, then it goes in everywhere. And then, so Jerry, what I'd like you and Winston and Rick, if we're following the state guidelines and we're doing everything that the governor says we should do, what else should the POA be doing?
We're enforcing in the station, anybody that comes into onto the grounds of the fire station, they have to wear masks.
Yeah, okay. And Rick, Winston, is there anything else that we can do?
Well, we haven't required masks because there's no mask mandate in either one of the counties.
Right.
I believe that we're doing everything that we need to do.
And then as Sue and I had the conversation today, and I hate to admit this, but I've got some relatives that firmly believe this is some governmental plot and it does not exist, which I'm sure we've all seen that on the news, but I know one of those people personally. And there's no convincing them. But as Sue and I were talking today, it then boils down to
Individual responsibility.
individual responsibility. So Alice and I, as much as we like going to church, and I do need that refreshment every 7 days, or I tend to start sliding a bit.
We've noticed.
I know, but, and so we haven't been since February and dearly miss it, but that's our choice.
It's true.
And looking back, like I mentioned earlier, I should have been going February, March, April, May, June, July, August, September, and I think the first case at the church I go to was October, November, and now there's 5 or 6, as I understand. So I missed all of that time, but I am sure not going back now. But that's my personal choice.
Well, you know, and I need to correct something. You know, I said that we don't have a mask mandate, but in particular operations, we do.
Yes,
You know, almost all of the gathering places for meetings require masks. And that's enforced. And in fact, what we've done is if people refuse to wear the mask, they're asked to leave. If they won't leave, we basically say that this party's over.
well, and then part of it too haven't we all, us 7, and Winston and Jerry, the people that come in and speak, because you're only allowed to come in one at a time, and the people along the back that you might not see. This has really been a nightmare trying to live through this Zoom and this holy cow, and all these Zoom meetings that people are having, what a pain this has been technologically. But we're learning, hopefully getting a little better. And, you know,
I tell you, you know, and Carla pointed this out in this morning's meeting, is had we not been actively pursuing live streaming of board meetings, we would be in deep, deep trouble. We would absolutely have no ability to communicate with the village.
right.
And our transparency would be right in the dumper.
But since we don't have policing power, our requiring a mask when the county government says you don't have to, or when the state says it's not mandated,
But we do have the right to run our operations.
Yes, we do. But we don't have the right to tell somebody you can't come in a restaurant or play golf or sit here 6 feet apart, which we've done for the last few months without wearing a mask. But again, we're mandating this.
Yeah.
As much as I miss giving you a hearty hug and a handshake, I haven't.
He wasn't saying that to me.
I noted the hug part.
What? Oh, sure. Is Richard Williams says require mask, it's not that hard, you're not doing everything you can do? Oh, absolutely. I go to Ingalls a couple of times a week, try to go early in the morning. And it's surprising me how many people don't follow the arrows and don't wear a mask. And I would, sometimes you want to say why, but all it's going to do is start a controversy. They've got their point and they got mine. So if I look down the aisle, I'm getting a loaf of bread and they're on the back right-hand corner of Ingalls, and I see them standing back there looking at that loaf of bread I want to buy, I don't go back there. So, you know, it's my choice.
Okay.
And then Richard Webb says something about what, wearing at the wellness center. I think there is a time period that Simon implemented for mask-only exercise.
Those are mask-only classes.
Right, and then we clean up,
Yep, exactly.
and then the next group is allowed to come in.
Right.
And what a pain that is.
Well, that's why we put on additional staff in the wellness center.
And Mark Pantley says, why isn't Government Affairs Committee meeting on Zoom? All other committees are on Zoom. That's just what they wanted to do.
Yeah, that's their call. We've left that call to each committee. And in fact, I will tell you, I've been in some of the Government Affairs Committee meetings, and they are socially distanced. And they typically wear masks into the room, so.
Correct.
Are there any other questions or comments from outside?
No.
Okay. Any other questions for Jerry? Jerry, I want to thank you so much for coming and informing us.
Not only that, Jerry.
It's
but thank-
always a pleasure.
Thank you for taking care of us, and tell your guys how much we all appreciate the entire
That's true.
village.
Okay.
No,
And-
do better than that, Jerry. No, just one swipe won't get it.
So, as I indicated at the beginning of the meeting, this is a somewhat shortened agenda for the first meeting of the year. We basically exhausted each other talking about objectives this morning, so we're tired. So that brings me to the portion of the meeting that is labeled other or outside comment. And are there any others to be aired? And there are no further outside comments?
Well, wait a second. Let's give them another chance, because like I said, I'm a connoisseur of next door, and there's supposed to be a lot of them on here today.
How many are on?
And it is delayed by a
42.
little bit. so-
42?
Yeah, you
Very
should.
good.
So I'm curious, how many people actually attended this meeting today? 44.
They're bailing, 41 now.
So
There is a comment.
and we know who you are, and so if you comment on next door, we won't tell you, you know, you could have attended the meeting, you know, but,
Okay, so now you're back up, Jerry. Hold on a second. Winston's already addressed this, but David Johnson, Winston, can you speak to the huge controversy on scheduling everything after COVID-19 at the wellness center that is happening on next door? Now,
He
wait a
just did.
second. I know. but maybe, Sherry, I'm
Maybe
sorry,
this guy
David
would
walked in.
enjoy
it.
And let me start off a little bit. This was my project 2 years ago, and we implemented it late last year. It took us about 18 months to go do the research, and thanks to
Thank God we did.
thanks to Kevin Alfont, who worked with me on this, and then Kevin rolled it out to the staff to get their input, the area managers and the supervisors and those dealing with us, the residents. And then he got the HOA involved as a test platform. And what this was had to do with the controversy we had going on about pickleball and room reservations, et cetera, because this was pre-COVID and our population was growing, and we had a lot of people that felt they were not being included because they couldn't get on a room reservation, for example. And as I recall, was it 4, 5, 6, or 7 different people that could have been called to reserve a room? This made it much easier to do.
It's online.
And then it got online, it got tested, and it worked out beautifully, and it just so happened it got implemented about the time COVID started. So pickleball players were able to get back in, small meeting room groups and that kind of thing got back in the game. And now we're in COVID, and we have the room and size restrictions, and the perception is that we're not allowing people to participate because of this. Am I reading that right?
Where are you?
So if you read next door posts or emails, you're seeing that the POA staff, POA board is restricting my use of this, and some of them are saying treating me like a child or as a nanny state or whatever. But this is following the governor's guidelines, and we have this in place so that we can schedule these people to come in and meet those same criteria and guidelines. Winston, in the quarterly report, mentioned that this could continue after COVID is over, and I'm thinking it was misinterpreted, so could you clarify one more time?
Yes, Pat. During the COVID timeframe, so we could open up the operation, scheduling was used on just about everything at the rec operation. And that was to provide, limiting the number of people, making more equipment available by, slotting timeframes and so forth and so on. Post-COVID, things will change. The rec committee, the rec management team, and rec users will take a look at the scheduling that's in place now. Obvious things like meeting rooms and things of that nature will continue to be scheduled because of the nature of the beast. But the other operations will be looked at, input will be gathered from property owners and management and users, and they will decide whether to continue, modify, or discontinue the scheduling program. And I'm not gonna make any supposition right now, but it will all be looked at. And I imagine some things will go back to the pre-COVID timeframe. And there might be some things learned from the COVID days that is carried forward. But what they are now and how they're gonna be implemented, I have no idea, and nor does anyone else.
And if anybody out there, my personal invitation to you, if anybody out there, please log on to your Telegram, log on to your Telego Village website, look up the meeting agenda, and if you have input to the Recreation Department on how it's being handled or should be handled, you own the Recreation Center. You own the Wellness Center. We all bought and paid for it. So you have a hand in directing how it's managed or opened or whatever. And I invite each of you to participate in those Zoom meetings. It's one click away.
Yes, Bruce.
Mr. President, I like Pat and several other you board members read every one of those comments that were on Nextdoor.
As did I.
As it relates to the Wellness Center. And all I can say is that the reason why we went to scheduling for 2 reasons. Number 1 was safety, and number 2 was fairness. Safety because we had to cut down the available space and the available usage to a fraction of what we would like for it to totally be. Fairness, because we did have to limit the amount of space that could be used for exercising, et cetera. If we didn't do the scheduling, then you would probably never get to exercise, some people, because they just couldn't get there. So it was only fair that we come up with a scheduling thing so that everybody during this time of reduced space, that they would have an equal opportunity to get in there and do and use the facility that was built for them.
So then my next question, again, rehashing what we've already talked about, does anybody on this board think that in the next few weeks it's going to get exponentially better?
Are you kidding me?
No, it's not. No, the numbers of COVID cases do not show it's going to get exponentially better anytime soon.
All you need to do is look at what Jerry reported to you for the last 2 months.
Okay, Jerry, I interrupted you, I'm sorry.
I just had one update for the village. One of the initiatives that the fire service has agreed to do, working with Jeff Gagley, was that we're going to do water flow test on all of the hydrants in the village, all 354 of them, I think is what the number is. We don't think we're going to get them done in 1 year. It'll be most likely a 2-year period. But we're going to color code the caps or the bonnet of each hydrant. So incoming firefighters or fire engines will be able to look and say, if it's a red hydrant, a green hydrant, a blue hydrant, they'll know the water flow that can come through that line.
That's a great idea.
Good idea.
So they'll be seeing us out in the streets, weather permitting. We'll flow the water down through the streets. We're not going to be going across lawns or anything like that. So.
Very good.
Yes.
I just wanted to say, based on this conversation that we just had about scheduling and Pat having that as a goal previously and getting that done, I just want to commend the staff, all the people who work in the various amenities, the committees, and everybody who was involved in being proactive in the areas of technology and amenities, because if we had not been already working on these things, we would have been so far behind the curve that, as you said, I mean, we couldn't, even our transparency would have suffered because we wouldn't have had any way to have our property owners tune in. So in addition to live streaming meetings, we had the online reservation system that we just talked about. The Tokwa patio opened, the Kahiti Mountain View patio opened, so we had outdoor spaces where we could still take advantage of things like carry out from the restaurants and things like that, still be outdoors, still socially distanced, but enjoy our amenities. And then the golf starters getting their tablets so that we could check in over the phone, because that would have never worked without that. So the IT department had a big hand in that. The golf department had a big hand in that. Everybody who was responsible for all of those things, I just say thank you, thank you, thank you, and commend you for that, because it has made life in Tellico Village during a pandemic much more enjoyable than it would have been had we not been able to participate in all of those things.
Yeah, absolutely. Thank you. Other comments? Okay, so I need a motion to adjourn. So moved.
Was that a second?
You don't want to.